confusion and embarrassment around bladder incontinence. It's sometimes called bladder leakage, urinary incontinence, or just leaky bladder, and it's more common than you might think. I'm Dr. Samantha Wild, a practicing GP and the Women's Health Clinical Lead at Bupa. And we've made this video to give you clear, evidence-based information. Watch to the end to find out what bladder incontinence is, the different types of leaky bladders, and what treatments are available. If you're concerned that you have a particular type of bladder incontinence that I mentioned, check out one of our more detailed videos on each one. So bladder incontinence is when you leak urine without meaning to. It might be a few drops when you laugh or sneeze, or a sudden gush when you're trying to get to the loo. And it's incredibly common, especially in women. But here's the key thing. Bladder problems are not just part of getting older or something you have to put up with after having kids. They are medical conditions affecting women of all ages and can have a big impact on your physical, emotional, and social well-being. And they're not something you have to live with. There are many effective treatments. There are a few different types of incontinence. Knowing which one you have helps us treat it properly. So let's go through them. The first is stress incontinence, and this is the most common type affecting 1 in 4 women. It happens when pressure on your bladder, like coughing, sneezing, laughing, or jumping, causes leaks. It's usually due to weakened pelvic floor muscles, often after childbirth. Number 2, urge incontinence. This is when you get a sudden, intense urge to wee, and sometimes you don't make it in time. It's often caused by an overactive bladder and can get worse during or after menopause due to hormonal changes. A classic example, you get home, put your key in your door, and you're suddenly desperate to go to the loo. The third type is mixed incontinence, so some women have both stress and urge symptoms, and we usually treat whichever one is bothering someone the most first. Overflow incontinence. This is when your bladder doesn't empty properly, so you get frequent dribbling. It's less common and often linked to other health conditions. And finally, functional incontinence. And this isn't about the bladder itself, it's about getting to the toilet in time. So for example, if you've got arthritis, mobility issues, or cognitive conditions like dementia, it might be harder to get to the toilet quickly enough. Lots of things can contribute to incontinence in women. Pregnancy and childbirth, menopause, age-related muscle changes, certain medications, neurological conditions, and lifestyle factors like caffeine or constipation. But remember, just because it's common doesn't mean it's normal, and you don't have to just live with it. If you're leaking urine and it's bothering you, even just a little bit, come and talk to us. It doesn't matter what the cause is. If you're weeing when you don't mean to, that's a sign to get help. We know many women don't bring it up. It's still such a taboo. But honestly, we talk about this all the time in clinic, and you're not alone. So what treatments are available? There's so much that we can do. The first is pelvic floor physiotherapy, and it really works, but we know it's hard to stick to. We'll also look at lifestyle tweaks like cutting back on caffeine, managing fluids, or treating constipation. And if physiotherapy doesn't help, there are medications that can calm an overactive bladder. And for some women, surgery might need to be an option, especially for stress incontinence. You really don't have to rely on pads forever. There are real solutions. And one thing I hear all the time is, it's just part of getting older, isn't it? And no, it's not. Yes, it's more common as we age, but that doesn't mean that you have to put up with it. There are effective treatments, and the sooner you get help, the better the results. So if you've been avoiding the trampoline, planning your day around toilet stops, or quietly buying pads online, please know you're not alone and you don't have to live like this. Talk to your GP, ask them about pelvic floor physiotherapy, and more importantly, don't be embarrassed or ashamed. We're here to help. Thank you for watching, and if you'd like to know any more about bladder health, please have a look at our series of videos below.